One.
Second phase of the training, I'm going to talk a lot less. Okay, I'm going to review the patient-centered ops. We're going to review everything, and then we're going to push forward to get more of these operations under control. Then we're going to train a little bit more training of wellness coordinators. What we've been doing, listen, it's probably too early to tell if we're having any impact. Me and him certainly don't want to do this. You guys don't want to do this if it doesn't change anything. So we think we're having an impact. We see a lot of conversions and everything kind of going up. You listen, your conversions go up, we don't have to get enough, you guys know this, we don't have to get as many new patients, which is, what's the key to any clinic? Number of new patients. I always say, you get enough, all your problems go away with enough new patients, right? So, okay. So we're going to go over this stuff, and I'm going to review the patient-centered ops, and then you guys are going to go right into it, okay? So, remember, you're going to read that history real quick, right? You're looking at the complaint, you're looking at the man. If it's not drawn on, I would send it back and get it drawn on. I like the drawing, if you guys, And I always tell the front desk, if this doesn't draw on, give it back, let them draw on.
I give it to them when they're sitting down in front of me. If it's not drawn out, I give it to them. I say, Eric, you mark down exactly where it's at.
Which is okay. I'd rather have it before it comes back, because that's going to be a time thing, because then you're going to have to sit there for a minute.
Okay.
And remember, if you can save a second in this clinic. Mm-hmm. It's that important. Okay? Remember, you're going to look at the history of chiropractic.
So should we just have the WCs look at that, make sure that
absolutely. And the signatures.
We don't have to bring it back, we don't have to send it back, we'll save time there.
Yes.
The same amount of time wasted.
I had two this week where, they just filled in what the problem was, not their name, not their phone, and I told the WC.
That should never even hit you.
Yeah,
right.
I was just like,
should never even hit you.
So.
And if that happens, you need to take the, hey, this is not acceptable. All this needs to be filled out, especially these signatures.
Mm-hmm.
So that she should be told once, at the most twice.
Right.
Because that's not that hard to do, right?
And that was pretty amazing that she let that go, because she's good.
Okay, listen.
She's not a slacker.
It happens, doesn't it? Do you ever give a bad adjustment?
Sure.
Yeah. Okay, so it happens sometimes. So yeah, just kind of, but listen, once you see it, correct it instantly. They're like puppy dogs. If you let a puppy dog pee on the carpet, they'll pee on the carpet forever. Okay? Okay, you're going to look at surgeries and injuries. I think that takes a minute at the most to look at. But make sure it's all there. That wellness coordinator should have that for you. The greeting, remember, it's all about not screwing the greeting up. It reminds me, I bike a lot. It reminds me of in the Tour de France, there's two kinds of races. There's the climbing of the hills, and there's going down the hills. Nobody wins the races going down the hills. Okay, you just don't want to fall. Okay, because then you can lose the race. You're not going to get the patient on the greeting, but you could lose the patient on the greeting. Does that make sense? You're not going to get them to comply on the greeting, but you can lose them on the greeting. Just don't screw it up, right?
Right.
Okay. Next thing is the chiro preview. I probably should have put 2 stars here. I think the chiro preview is incredibly important. Okay, that should be memorized. Remember, I said you guys should have that to a T. Hi, Dean. My name is Dr. Daniels. I'm going to go over a little bit about what we do in the clinic here. Mostly we see nerves, muscles, and joints problems. If it's a nerve problem, it's generally the worst. It can take the longest to heal, and you might need surgery on the nerve problem. I can see that you didn't have any pain in the arms and the legs. You probably don't have a nerve problem. I can see that you've got some of this pain going down the leg. That can be a nerve problem, and we're going to check that. Next thing we're going to look at is muscles. I'm looking for spasms. Spasms are involuntary contraction of the muscle, very painful, or knots. Knots are when the fibers, so if these are the fibers of the muscle, come and start to form a knot. Those knots are very painful and can make the pain travel. So we're going to look at spasms and knots. The third thing we're going to look at is the joints. Here's where I think chiropractors are a little bit more special. Okay, because of old injuries, poor posture, poor working habits, genetics. Some of these joints can start stiffening up and locking up. Okay, if that happens, those cause pain. The stiffness and the lockness doesn't go away by itself. It will get worse. That's why most musculoskeletal problems get worse. What a chiropractor does, you can pop, crack, manipulate, or adjust. What that does is it loosens up the joint. So we take a tight joint and loosen it up with a pop and a crack. Okay, that's a little bit about what we do. Now, here's the other thing. I'm feeding in, and you're going to count how many times I'm educating that patient. That's definitely an education. Is there any doubt in your mind? That's one. Okay, and the themes are all going to be the same. Does that make sense? Because you want them to hear it basically over and over again to get it into their head. Chiropractic preview is very important. So both of you guys, when you go through your stuff, I'm going to be really forceful on that chiropractic. I'm going to really pick it apart. Okay? I go into my history then. Sometimes you can do the history. If the doc wants to do a history and then do the chiropractic preview, I'm okay with that. Okay? History, remember, the radicular problems go a little bit more in detail. Okay? Hey, I've got leg pain. How often do you get leg pain? Once a month. Hey, I got leg pain. How often do you get leg pain? Every day. Those are two different things, aren't they? You guys know that, right? So dive into it. Okay, you guys are a little bit more veteran. You guys are veterans. Okay. The examination. I've broken really the examination down to two pieces. A joint muscle and a nerve. Okay, so when we go through the nerve, and let me, if there's any, you guys do it different or got questions, let me know. So I'm going to do the nerve first. Why they're sitting there, tap the reflexes, whatever. No radicular, I'm probably done. If there's radicular, I've got to do some muscle testing, right? Got to. It's a mandatory. Okay, we're going to use the lower extremities, extensor hallucis longus, L5, tibialis, L4, peroneal, S1. Remember, the peroneal goes this way. If this is the foot, it's just not down, right? Strength, tibialis, okay, so get the muscle testing perfect. You're going to miss patients if you just pull straight down because they can recruit other muscles. So you have to have those muscle testing perfect. The exam this way should be very quick. Reflexes, face down, Mrs. Jones. I'm going to go and palpate for the myofascial component. You should be able to find myofascial. When you find it, zone in on it. Any problem that you're having on the exam, just don't, hey, this is a problem, and pass through it. You make a spectacle. If you find a weak reflex and they got a radicular finding, that's huge with us, isn't it? It's like the worst one we get. Okay, so show them that reflex. Okay, show them how it's decreased. Make sure they understand before you move on. When I have a weak reflex, I think just about everybody understands it, don't they? And they can feel that one, can't they? And when they can feel it, it's more powerful. So don't forget to do those things too. So the exam to me is joint muscle. Bang, they're face down, I'm going to do a myofascial. I'm always on the opposite side that I'm palpating. It's going to be a little easier to get. Around the iliac crest, up the erectors, quadratus lumborum, all through the chaps, teres, suboccipital. You're going to find them. How many of the patients have myofasciitis? Everybody. Okay, and it is a component in the pain. Then hey, listen. So the exam. Why did I start the exam? Because you could go way off base with the exam and you can get way behind in the clinic. So you have to have an efficient, quality, quick exam, right? Okay. So after I do my muscle palpation, I sit them up. I go right into motion palpation. Okay, but I'm pointing, feel that knot, feel that knot. These are problems. These are knots, not spasm. I'm going to go over them later. Sit up. I'm going over and I'm writing down. Why am I writing down?
Oh, you can see what you're
Yeah, hold up, Miss Dean. I gotta record. I love the word record. This, okay? You know, I gotta record this. I'm gonna motion palpate. I motion palpate sitting up. If you do it lying down, you do leg checks. I'm okay with all that, right? I motion palpate. You feel this one? Do you feel that one? But you're pointing out again the problems. I don't point out all the stuff that's good because it can get lost in the problems. Okay? Report of findings. Gosh, that one's huge, isn't it? Okay, now my report of findings follow along with my same theme of the chiropractic preview, right? Okay, hey Dean, we looked at your nerve, good news. Nerve tested out, perfect, no problem, we just took the worst one off the table. Okay, we then poked around at the muscles. I did not find spasms. If I do, I tell them. Mostly I'm finding knots, aren't I? But I did find knots. I found a lot of knots. So I found some knots through here, up, through there and there. Those are problems. Okay? We're going to give you some stretches later okay, to pull out some of those knots. As we correct the spine and get the spine to function and move better, they'll also come out naturally, okay? So the third thing we looked at then was the joints. And remember, you had some, I love to touch them at this time, you had that stiffness, tightness here, here, and here. Now, you get that stiffness and tightness from old injuries. I saw you've been in a few car accidents, so you can relate that back to them. Poor posture. I see you've been sitting forever. You're a secretary, or you know what I'm saying, high tech, so you can relate that back to them. Because of those things, combinations of those things, you got some problems in those areas. Have you been to a chiropractor? No, I've never been to a chiropractor. Have you heard we pop, crack, manipulate, or adjust? 99% of them will hear one of those. If they don't, now I gotta kind of go off a little bit. Okay, so what that does is we're gonna take those tight, stiff joints, we're gonna put a little force and we're gonna move those joints. We're gonna loosen them up. When we put that force and loosen up that joint, sometimes you can hear those pops and cracks. Similar to cracking a knuckle. So let's say I love this explanation. So let's say I don't have enough, let's say my finger is not moving down enough. I take that joint, I put it all the way down and give it a little ump. It pops, you see it move. That's manipulation. That's what we're gonna do here, here, here. Okay, now, we're not gonna adjust it, move it once and get it loose. It's similar to a tight muscle, like a tight hamstring. We're gonna have to stretch it and loosen it up over a time period. So you're gonna need a few adjustments. I'm gonna go ahead and I'm gonna adjust you, and then I'm gonna make my total recommendation after. Is that fair? Okay. So again, I got some more education in here, didn't I? Really, I got some education in here. Here, right? Probably not gonna educate them a lot as I adjust, but this then, after the adjustment, it's the huge recommendation. Okay, Dean. Adjustment went pretty good. Okay, still gonna need a couple adjustments to loosen that up. I wanna see you about 10 times over the next 30 days. Preferably 3 times a week, then 2 and 2. Okay, is that something that you could make? Okay, so I'm gonna deal with that right there. When we first start to work with you, you can get a little sore. If the tissue isn't used to moving or functioning or stretching like that, it can get a little sore. Just like if you're not used to working out and I send you on a mile run, you're limping the next day, but you've literally done something good for your body. Okay, you just kind of have to continue. Does that make sense? Now, we're also going to give you some stretches. Remember the knots in the muscles? Okay, so I'm going to give you some stretches for down there. We're going to stretch 2 to 3 times a day. Do you work out? I was prepared for you to say yes. Okay. So let's say he says yes. I always want you to do the stretches after the workout. Your body's warm, you're going to get a better bang for the buck, even if you stretched already a couple times. If you get sore, I want you to stretch. You're going to relate that back to me if that felt better or worse after. Okay? We're also going to start to some icing. So you're going to stretch first. Remember, you're stretching 2 to 3 times a day. You're going to hold those. This will all be on a piece of paper for you. You're going to hold those stretches 10 to 15 seconds. Everything we give you is going to be on a video too. So when I see, have you ever saw that you're over giving them too much information? You almost can see the body language, can't you? We're going to give you a video. Have you ever seen the body? Oh, okay. You don't have time. Oh, okay. So you're relating to that patient. But look, that recommendation at this point is the most detailed, right? Now, I'm almost going to repeat that recommendation. I'll probably condense it. Okay, they've got the recommendations. Now, I'll take them through the stretches if there's nobody around. Okay, if it's busy, or even if I think it's going to get busy, wellness coordinator's doing it. So you can either do that handoff behind, and then you're going to do another repeat of the recommendation, probably condensed firm. Okay, Jim, this is Dean. I want to see him 10 times over the next month. I'll show him some ways to save money. We're going to show them the lower back stretches. You're going to do those a couple times a day. You're not going to overstretch, so if you want to do them more, that's cool. We're going to start to ice, so we're going to go over the icing with you, okay? And then Jim will take care of you. Go over we're going to get you a video on all this. Questions, comments, concerns from me? Boom. Or most of that is done in the front if I went over it. Okay, so Jim, we've went over the stretching with Dean in the back. Any questions? I'm going to send you an email a couple times, 2 to 3 times a day. Okay, if you work out, you're going to hit them after the workout. And by the way, where's the format? And I want, this is just our first generation of the form, so we're gonna tweak it. All the recommendations are gonna be on here. Okay, I would think we would make a copy of this that then goes into the file. Okay, and I want the lettering bigger, obviously, you know what I'm saying, everything, boom. And so you'll have the visits on there for the joint, you'll have the stretches, length of holds, times to do it, any special instructions, don't miss the stretching after the workout. If you get sore, I want you to stretch. If my patients, some of the patients I'll ask, is it better or worse in the morning? Worse, I'm gonna have them stretch at night before they go to bed, or even in the morning, that's a special instruction. Hit them up with a lot of that. You wanna write on that form and personalize that form to them, that's the key. If you've ever seen a form, I always like to write on it and everything because that personalizes it to you. Does that make sense? And patients are gonna like to see that, okay? I'm gonna go out and find a little bit of a tangent. We've got a patient in Austin that wrote up a bad review on us, and they say, they make the same recommendations to everyone. Now, 95% of the patients that I see in the joint, I could probably make a recommendation of 2 times a week for 4 or 5 weeks, or 3 times a week for 2 weeks. You know, see what I'm saying? Probably between 2 recommendations, isn't it?
Right.
Okay, why? And the same thing with the stretches. So what do I say about the stretches to avoid? Why does he have the same stretches as I do? The stretches are put together to hit the most common knots in the area. We all have the most common knots in the area because we all do the same basic stuff. Sitting is not good. 10 minutes of sitting is not good, right? It's unnatural, okay? But we're spending hours, okay? So we tend to develop knots into the same. And I've never had a patient not buy into that. Now, if we don't get all the knots, that's when you're gonna get to your specific ones, but we're starting here. Does that make sense? Okay. So the recommendations, if